Well, the most common type of ankle sprain is what we call an inversion type injury, in which someone lands on their ankle or rolls their ankle into an inward position. This can commonly happen for some individuals, athletic activities such as running, jumping, or even just stepping off a curve in an awkward fashion, leading to them rolling their ankle. In many cases, or in some cases, individuals appreciate immediate pain, particularly if it is more of a sudden event. And associated with that, they also have swelling around the ankle that they may appreciate once they start look at their ankle much closer. And occasionally people have bruising, and that bruising and swelling represents an acute bleeding and rush of fluid to that area in the body's effort to try to self-heal itself and in response to that injury. Majority of ankle sprains we treat conservatively with a method that we call the RICE method, R-I-C-E, representing rest, icing, compression, and elevation. From that period of time, we also recommend people to have a moment or period of activity modification, at which point in time they refrain from higher impact activities and other activities that may put their ankle at risk. A subset of patients, in addition to this, will require physical therapy, and that physical therapy is focused on strengthening, improving their range of motion, and their overall recovery from the injury, as well as working on things to help prevent it occurring in the future. From that point, you unfortunately still have a subset of individuals who may require surgery to treat such a severe ankle sprain, and in those cases it requires us to go in and either reconstruct their ligaments or to repair their ligaments so that they may have a stable ankle going forward. In the case of ankle sprains, some individuals have isolated events and they have a significant period of time before they ever have another event, or they may not have another event. However, in some cases, individuals, if they have a persistent or repetitive activity that puts their ankle at risk, can sustain additional ankle sprains. When individuals have a significant number of ankle sprains over a short period of time, or they continue to have repetitive ankle sprains, or what we call instability events, we then call that a diagnosis of chronic ankle instability. In those cases, we advise individuals to either refrain from the activity that puts their ankle at most risk, or to potentially use an ankle brace, which can provide them additional support to prevent the injury from occurring. Unfortunately, if they continue to have instability events or chronic ankle instability and chronic ankle sprains, again, surgery may be indicated for those individuals. At the UPMC Foot and Ankle Center, we have a number of specialists who are well trained in dealing with these injuries, such as ankle sprains, all the way through severe cartilage injuries that may require either conservative treatment, all the way to the progression of potentially requiring surgery. And so with these foot and ankle specialty trained orthopedic surgeons that we have, I believe our center has the ability to treat patients globally regardless of their needs.